Is it safe for us to go back to work? Not yet. Is it safe for us to hang out with our neighbors? Not yet. Run around in the park? Not yet. Not according to this paper. Assuming social distancing measures are maintained, the following paper predicts that we're going to experience about 100,000 deaths in the United States alone before the crisis is over. Let's take a look. So this forecasting COVID-19 impacts on hospital bed days, ICU days, ventilator days, and deaths by US states in the next 4 months is published on medRxiv. This is not a peer-reviewed source. No, it's a server where almost anyone can just upload a paper. However, this paper comes from a very reputable source. Dr. Murray is a professor at the University of Washington and the director of the Institute for Health Metrics and Evaluation, IHME. And this is the institute that published the following paper. Now, I will not go into the details. This is a lengthy paper, very interesting if you want to read through it. However, it comes with a wonderful online tool that I'd like to review together with you. And of course, all the links will be down in the description. So this paper is only for United States of America, but it does go into detail by state. We can look at hospital resource use, how many beds needed total, ICU beds, and the model predicts that the crisis will peak around April 14th, or 15 days from the time of this recording. And on April 14th, we're going to need 230,000 beds. We're about 50,000 beds short. We're going to need 35,000 ICU beds, intensive care unit beds, and we're about 15,000 short. That sounds like a problem to me. We're going to need roughly 20,000 ventilators. Doesn't list here how many there are available, but I would imagine that would be a problem as well. Good news is the model predicts that the number of beds needed will start dropping right around mid-April, which is very good, very good. We will go back to today's numbers mid-May to June. So the worst is not here. The worst is coming. Deaths per day are predicted to peak in 15 days at around 2,341 COVID-related deaths that will occur, according to this model's prediction, on April 13th. And the total number of deaths ranges from 40 to 160,000, with median at around 80,000 deaths total from this pandemic. It's not a very huge number, but again, the model predicts that social distancing measures are maintained. Stay at home, wash your hands. You can look at by the state, although situation in United States looks pretty bleak. Personally, I was a little relieved when I looked at the state of Pennsylvania, where my wife and my parents are. We're going to peak around April 17th. The beds needed at the peak will be around 10,000, and we have around 14,000 available. So we're in the clear, the total number of beds. Still, intensive care units, we're about a third short. So 1/3 of people are predicted to not have an intensive care unit bed when they're going to need one. This is a big problem. And you can look yourself, of course, link is in the description. Take a look for your home state and think whether you want to maintain social distancing measures or you want to increase them. Maybe you want to walk your dog for 5 minutes less than the typical 30-minute walk that you normally take. Maybe don't go out with your friends. Maybe only go shopping when it's needed. Guys, stay safe, stay at home, stay alive. Good luck to all of us.